Thank you so much for inviting me to speak. I go by Faye, and I'm going to go ahead and discuss what most people have questions about, and most of my patients as well. So I have nothing to disclose. I do not get any incentives from any pharmaceuticals or so. I work for the Cleveland Clinic. I'm one of many rheumatologists. I have amazing colleagues that work with me. And I'm so fortunate to have all my colleagues around me, surrounding me at the Cleveland Clinic. So the objective of this presentation is trying to answer the most commonly asked questions. And a lot of those questions came from previous Arthritis Expo. But if you look at, when we look at most questions sent to us, they're pretty much similar. And again, it echoes my patients' questions as well. So that fits what most people want to hear about. I also would like to, I'm going to use the arrow with my mouse so that I'm hovering to where I want you to see. But I'd like people to understand what arthritis is. And the reason I say that is because a lot of times patients come to me and they're told they have arthritis, but never explained what type. So we'll talk more about that because that's important. And to address some of the myths and remedies on arthritis, there's so many more. We cannot cover everything in this session. And try to provide you at the end of this talk with something to empower you, to show you that you have more control towards your health and joint care. So let's get started. Again, I'm going to start with the question that's raised, and I'm going to try to answer it. So what causes arthritis? Before I can answer what causes arthritis, I always want to make sure we define what arthritis is. So usually the word itis at the end of every word means inflammation of some sort. So in arthritis, arth is a joint, so not Arthur. So arthritis, so it's a joint inflammation or a joint disease or even a joint damage. So what causes that is there's different conditions. So, for example, a wear and tear or a damage to the joint, maybe it's a sports injury, maybe wear and tear over the years, hard work, etc., can lead to osteoarthritis or degenerative joint disease. That's another word you might hear. If it's in the back, some people will hear the word degenerative disc disease. Trauma, injury to the joint, internal derangement, meniscus tears, etc., can lead eventually to joint damage much sooner. Inflammation is one common one. Typically, we talk about rheumatoid arthritis, but you'll see there's many other inflammatory diseases that cause inflammation in the joint. Infection is another one. It's not as common, but infection can also be a factor as well. So there are several different types of arthritis or arthritis for the plural. And there's osteoarthritis, for example. There's rheumatoid arthritis. There's gout, pseudo-gout. So pseudo-gout would be calcium crystals. Gout would be uric acid crystals. Psoriatic arthritis, typically in people with psoriasis or a family history of that. Ankylosing spondylitis, which affects a lot the spine. Lupus, systemic lupus. It could be juvenile or adult. Juvenile rheumatoid, which is now known as JIA, juvenile idiopathic arthritis. And there's different classification of that. Infection, septic, trauma-related, reactive arthritis. So something that occurs after an infection, whether it's a self-limited or more of a chronic form. And in the past, they used to call it Reiter's syndrome, but that's one. The reactive arthritis is one. People with Crohn's disease or ulcerative colitis, they can also have a form of arthritis that causes inflammation, especially in the large joint. Celiac disease can cause some form of arthritis, and many, many more we won't have time to cover here. But you got the picture. So there's different types of arthritis. So that's why when a patient is told they have arthritis, I'd like them to know what kind they have. So this is the first thing I go over with my patients when they come to me with x-rays or a condition they were told they have arthritis. I like to figure out what type of arthritis they have, because that determines what treatment works for that. And so typically, people will have arthritis from most common one would be the osteoarthritis. In rheumatology clinics, another common one would be rheumatoid arthritis, but gout and other conditions can also exist. So I'm going to try to cover just a few of them. So I'm going to cover the osteoarthritis, the rheumatoid, and the gout. I do want to say that when a rheumatologist is evaluating a patient with joint pain, so patients can come to us and they have joint pain, and we'll try to figure out what kind of disease is causing that, what type of arthritis. Usually in our mind, we're trying to separate mechanical, non-inflammatory versus inflammatory. And so the non-inflammatory mechanical typically are the trauma-related osteoarthritis, degenerative disc disease. The inflammatory could be rheumatoid, gout, pseudogout, psoriatic arthritis, lupus, et cetera, and the list goes on. So let's cover the most common ones, the top three, and I think that gives you a good idea of what the different arthritis could be. So in a few moments, in a few slides later, you'll see me talk about individual osteoarthritis, rheumatoid, and gout. But here's another question that comes up as well. Can arthritis go away or be cured? Well, it also depends on what kind of arthritis we're dealing with, right? So if we have a wear and tear of the joint, like there's enough damage, there's no more cartilage, the bone is rubbing on the bone, we really can't cure it except for maybe a joint replacement, a surgery. We can improve symptoms perhaps. If it's a trauma related, let's say somebody had like a meniscus tear, and that's causing a lot of pain and swelling, and the meniscus tear is repaired by surgery, you can consider that cured in a way. You're not bringing a new meniscus, but you're correcting the joint. Inflammation, it depends, right? So with inflammation, we'll talk more about it in a minute. So it depends if it's a acute inflammation like gout or chronic inflammation. And infection probably can be cured, because if the infection is causing the joint, if it's an acute infection, like a short-term infection, not something you've had for years, that's causing the joint inflammation or the arthritis, you treat the infection, antibiotics or what have you, and then the joint should recover from that. So with inflammation, it depends on the cause, right? So if it's an acute inflammation, for example, somebody had like an infection, like parvovirus is another one we talk about, and then they had a arthritis after that, usually that resolves and it goes away eventually, and then you recover, with steroids or with anti-inflammatory medicines or with time. Gout is another case that if somebody has an acute gout attack, it feels like it's very painful in the joint, like someone broke it, and it's very sensitive and it's inflamed and red and swollen. And then you treat the gout attack and it's completely gone, and that joint looks just normal. Even on X-ray, we may not see gout changes unless repeated attacks happen in that joint. So with rheumatoid, it's different. Rheumatoid is more of a chronic condition. So usually it's not cured, but it's treated, and we try to put it in remission. When I say remission, we're trying to control the disease to the point that there's no clinical symptoms and it's not causing any more joint damage. So the two most common arthritis people talk about, and the common question I get as well is, how do I know if I have osteoarthritis versus rheumatoid arthritis? So I'm going to refer from now on to osteoarthritis as OA, just to make it easier and shorter for me to speak, and rheumatoid arthritis as RA. All right, so OA and RA. So I'll talk about those as well. But when somebody asks me in a presentation, not in my office, or a question is raised, and do I have rheumatoid or osteoarthritis? Really, the best way to answer the question is to have an evaluation by a rheumatologist, so that we can ask the pertinent questions, examine you, and if we need x-rays or blood work, that might be supportive as well. And then we can give you a more educated guess, and not just try to guess and assume that you have this or that. But I'll show you some pictures later, where sometimes you just look at the picture and you have an idea what the person has. So OA is the most common form of arthritis worldwide. And then often, sometimes we use the word wear and tear or degenerative joint disease. So that's the osteoarthritis. And it's not typically known to have that systemic inflammation or the aggressive inflammation that you can get with rheumatoid arthritis. So with rheumatoid arthritis, we have more inflammation going on, so more joint destruction. So we'll talk about that as a result of the inflammation. We'll talk about when we get to the rheumatoid or RA slides. So ultimately, with osteoarthritis, over time, a person would eventually get wear and tear or damage to the cartilage or the meniscus or the discs. And at some point, the bone would start rubbing on the bone, and that's what causes a lot of the pain. So how is osteoarthritis treated? Well, the best treatment for osteoarthritis is really prevention first. So if you have early osteoarthritis or you have a strong family history of that, you might want to start working on protecting your joints. And this is what I want to talk about also at the end, what else you could do. But prevention of osteoarthritis is pretty much the same guidelines you would have for preventing any other arthritis in general, outside of infection, obviously, because that has to be treated by antibiotics. So avoiding trauma and injury to the joint will save the joint from getting worn and torn over time or more damage. Avoiding being overweight or obese, which is usually defined by a body mass index for overweight above 25 and for obese above 30 and for morbidly obese above 40. And then I showed down here that the body mass index is your weight over your height squared. So you can go online, type your weight and height, and it'll give you your BMI, body mass index. So we have enough studies to show that when we carry a higher BMI, the osteoarthritis progresses and the pain is worse. And actually losing 10% of your extra weight can make a tremendous difference to how you feel, the pain and the progression of osteoarthritis. But we also have studies that in RA, in rheumatoid arthritis, especially in women, the leaner the women are, the more their BMI is in the normal range, the rheumatoid arthritis does better. So, but that's also in many different conditions. Even now we talk about infections and COVID-19, and that being obese or high BMI has more complications. So trying to always stay healthy and lean is always best. You don't have to be very thin. You just have to be in the normal body mass index range. And it's nice because it's a big range. So like anywhere from, sorry, the computer is asking me to put in some codes, between 18 and 25, but preferably between 20 and 25 would be great. Sometimes if you're older, getting up to a BMI of 27 is still acceptable. Other things we could do for osteoarthritis is maybe wearing a splint. For example, for the first CMC, that thumb osteoarthritis, which is a very common osteoarthritis in the hand, there are some splints that one could wear to support it, for knee braces, etc. And that's just supportive. It's not going to cure the problem. But exercise has been very effective in osteoarthritis. And exercise could be anywhere from Tai Chi to muscle strengthening to bicycle to swimming, walking, yoga, etc. When we exercise and we strengthen the muscle around the joint, we're actually adding more support, like your natural brace, to your joint and more shock absorbent. And you'll be surprised how much better you feel when you exercise and you train your muscles to be strong enough. What I love about that is you exercise your muscles, you make your muscles stronger. Guess what's going to get stronger? Your bones. I do also specialize in osteoporosis. I don't want my patients to lose bone density and have osteoporosis. So weight-bearing exercise would also help with that. So with osteoarthritis, you're not going to do the jumping, like jump ropes and high impact. You're going to do more of a low impact. So, but still you can gain muscle and get your joints to feel better and get stronger. Range of motion is very important. Stretching is very important. If they say body in motion stays in motion, so let's continue with that. Another very key important aspect is avoiding smoking. So smoking can hurt the cartilage and the discs, but also smoking can be harmful for conditions like rheumatoid arthritis. So we have enough evidence now that we know that even in people who have the positive blood work, seropositive for rheumatoid arthritis, even before they have the disease, those who smoke have a higher risk of developing rheumatoid arthritis versus those who don't smoke. So smoking is key. So avoiding smoking or smoking cessation is very important, and in joint health in general, even in bone health, not just osteoarthritis. And a lot of times we don't talk about healthy diet. We'll talk at the end more about the diet, but when we have an unhealthy diet, we're going to hurt more. We're going to be more tired. Our body's struggling to handle all these food that's not making us healthier. But also, we're not inviting a lot of the nutrition into our joints and cartilage. And also, if we're eating a diet that's very high in cholesterol and saturated fat, and we're blocking our arteries that supply the cartilage and supply the discs, then we're not allowing the nutrition to get into the cartilage and disc, and then they degenerate faster. So many reasons why diet is healthy, not just for weight loss and all that. Another aspect is we know that there's something else other than the weight mechanically that's affecting the osteoarthritis, because they've done studies where they found that the hand osteoarthritis, especially this joint, for example, is more affected in people who are overweight than people who are normal weight. And that we're not walking on our hands. So what's going on could be that there's the extra fat we carry are probably releasing like harmful chemicals or molecules that are harming our cartilage and our joints. So that's important as well. So traditionally, as far as conventional care, so they've changed a little bit the criteria over the years. So cortisone injection is not the top of the recommendation. Surgery is only ultimately if you've tried everything else. And so the common recommendation now is to try to do the exercise preventive care we talked about earlier. But if you need treatment or medication, try the topical treatments. So there's different topical anti-inflammatory medicines. There's also capsaicin, there's icing and heating and all that. So there are also medicines you can take by mouth, but you have to be careful. They carry a lot of side effects. So whether we're talking about the anti-inflammatory medicines, classically naproxen, ibuprofen, meloxicam, et cetera, it's important to remember that those don't come without side effects, right? So they can affect the kidneys, they can cause stomach ulcers and bleeding and gastritis, they can cause colitis, they can cause ulcers, they can cause kidney failure, they can raise the blood pressure, they can cause a risk for heart attack and stroke. So in some cases, so knowing that and being careful, and plus if somebody's on blood thinners, they can't have those anyways. We'll talk about more natural things in a few slides. Tylenol, that's known in the US as Tylenol, but I like to use more generic terms here in this talk. So acetaminophen, and in Europe, you're probably going to see the word paracetamol. So acetaminophen are, pain relievers. They don't have a lot of anti-inflammatory benefit, but some people say that it helps their osteoarthritis. Some people don't find it helps. So if this helps you, be careful not to exceed the recommended dose because we don't want to have liver failure and liver damage with that. But remember, any of those are not really curing the problem. They're just giving you a little bit of pain relief.
Did other people just lose sound and video?
Lose me?
I can still hear and see you.
They can't hear me?
No, I can. Anyone else?
The video just came back on for me, and now I can hear you.
Okay.
Okay.
Are we good? Can I continue?
Yeah, I think so. Thank you.
Should I hold off or?
No, it seems that I'm hearing. I'm seeing that people can see and hear you.
Is it working?
So I think we're good. Mm-hmm.
Okay.
We're good?
Yep, we're good.
I'm sorry, I can't hear. Maybe it's, I'm going to message you. Shall I continue? Yeah?
I can hear you.
Okay.
We can hear you and see you.
Okay, shall I hang up? Okay. All right. Shall I continue?
Yes, please.
Okay, I'm sorry. I'm not sure what happened. Is it from my side? I apologize, but we're going to make it happen. We're going to make it work.
Okay,
all right.
Thank you.
Okay. So as far as the medicines, just be careful and be aware that they're not going to cure anything, and then just don't expect too much from them. And plus, be mindful that if you're having side effects, it's not worth the medicine. So the risks would outweigh the benefits of taking that medication. We're going to talk about turmeric and other supplements later. That is an option as well. And then cortisone injections, gel injections are also options, especially for knee osteoarthritis. And obviously surgery is an option. RA or rheumatoid arthritis is different than osteoarthritis. It's more known to have an inflammatory component, and the inflammation in rheumatoid arthritis, yes, typically affects the joint and the lining, synovium. People get synovitis, but it can also affect other organs. So when we get inflammation and synovitis, then we might end up with joint erosions, and that eventually can lead to more damage and deformities and crippling disease. Fortunately, nowadays, because we have effective treatment, we're not seeing as much of the crippling disease. The organs that can be affected in rheumatoid arthritis range from lungs, lung inflammation, eye inflammation, heart, skin, nervous system, etc. People can have rheumatoid nodules with rheumatoid arthritis, which are lumps that typically occur in the elbow, but they can occur anywhere, any pressure areas. Usually they're not painful, but they can be. And then these are like not in the joint, they're in the soft tissue. And most commonly, they're more promoted when we have areas that we have more pressure, like friction areas. That's why the elbows, because we lean on our elbows. So treatment for rheumatoid arthritis is really based on of course, healthy lifestyle and all that, exercise, but primarily the most effective treatment that we have in the conventional medicine treatment is medications. And it ranges anywhere from anti-inflammatory medicines to steroids to disease-modifying drugs, which are more effective than just taking an NSAID, and biologic medications. When we say disease-modifying drugs, we have the conventional ones, like you've heard of methotrexate, leflunomide, sulfasalazine, hydroxychloroquine, etc. And then we have the biologic disease-modifying drugs, which are the newer ones. Some of them are injectable, some of them are by pills. But also with rheumatoid arthritis, we know that following an anti-inflammatory diet and managing stress is very, very effective. And we'll talk more about that at the end. I'm going to show you some pictures. These are from the American College of Rheumatology website, and some of them from books. So this is nice because it shows you kind of the idea between difference of rheumatoid and osteoarthritis. And so sometimes you go see the rheumatologist, and in the first minute or two, the rheumatologist already knows what you have, if you have the changes that we're seeing. So if we see changes like with osteoarthritis, for example, typically affecting the middle knuckles and the far knuckles, we call them the distal interphalangeal joints. And then especially if you have bumpy, bony feeling over there, those are nodes. They have a name called Heberden's nodes. And if they're up here, they're called Bouchard's nodes. So these are typical of osteoarthritis. And a lot of times the wrist area, the base of the thumb is affected, and it may look also bony, typical of osteoarthritis. With rheumatoid, you see that most of the joints affected are usually the bigger ones in the hands, like the metacarpophalangeal, MCP joints, but also could be the middle joints. Now, sometimes a person with rheumatoid might also have osteoarthritis at the same time, and they might have changes there. But for rheumatoid, it's typically these joints and these, and these, but also the wrist can be also affected in this patient. You can see there was surgery also, and you could see what I'm referring to as the rheumatoid nodules right here, and then here, and here, and here in different areas. So I haven't talked too much about psoriatic arthritis, but this is a very good picture because it shows almost every aspect of it. So you could see the red lesions, the rash here. That's the psoriasis here, 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 here. You can also see how the psoriasis has affected the nails. You can see the nail changes. This is not fungus. This is nail changes from psoriasis. And you can see that in psoriasis, the swelling could affect the distal joints like you see in osteoarthritis, but that's inflammation. That's a different effect. And very interesting. This is why I love this picture, because it gives people more perspective. I feel bad for the patient who's suffering. This picture shows you the sausage finger. You see the index fingers, compare the one with the other one, and you'll see that this one looks like a sausage. We call it dactylitis. And this one looks really almost normal compared to that one. People with psoriatic arthritis usually have psoriasis, but not always. So sometimes it's a bit tricky to diagnose. We have no blood work for that. And if the disease is early, the x-rays may not show it. So this is why it's important for us to know what other conditions one has and what's the typical pattern. Gout is another common one. And gout, I'm going to spend just a few extra slides on that, because gout is a treatable condition. Unfortunately, sometimes I get patients who haven't had their gout treated, and they've had so much destruction that could be completely avoided. We have very effective treatment. And yes, lifestyle and diet makes a big difference in gout. But let's talk a little bit about what is gout. So gout is a crystal-related disease. So crystals of uric acid, another term we call is monosodium urate. So the crystals of uric acid, when they get deposited in the joints or bursa or tendons or the soft tissue. And if they're in the soft tissue, we call them tophus or tophi for plural. And with the gout, what happens is a person would have a very high uric acid. So uric acid, we all have a little bit in our blood, but when it gets concentrated and high in our blood, it almost crystallizes almost like when you put too much sugar in a cup of tea, and at the end, it's not going to dissolve, it precipitates, and you see those crystals. So we get so much crystallization of that uric acid in our blood when we have high concentrations. And so it deposits in the joints, in the tendons, in the soft tissue, in the bursa, etc. Now, gout usually is not a chronic inflammation like rheumatoid, like you have it on all the time until you treat it. Usually gout typically gives a very painful gout attack, and it usually is 1 to 2 weeks and you're fine. Well, it can go away on its own, but that 1 to 2 weeks could be very painful. So most of the time we need to treat it. Now, if somebody doesn't get treated for gout and they keep getting those attacks, eventually they can get joint damage. They can get the tophi that really collect and they eat up on the joint as well and the bone. And unfortunately, I've seen that in my practice, and I always wish the patient came sooner or was referred to me sooner to be able to take care of that. But we could still treat that. So this is a picture to give you an idea. So the typical joint swelling in gout is that big toe that gets swollen. And then you see that in people, there's a name for it, it's called podagra. So you hear a lot of people had their gout in their big toe. So that's pretty much convincing that one could have gout, especially if their uric acid in the blood is high and they have this finding. But gout attacks could happen anywhere else: ankle, wrist, finger, elbow, different areas. It doesn't have to be in that area. This patient has the tophi or tophus, the collection of the white pasty-like crystals that collect in those areas. And there's definitely there might be some tophi here, but there's a lot of inflammation that you can see. And this is one of my patients. This is another lady who's not my patient, but this is a very good picture because you could see how someone can have osteoarthritis, right? So you could see that these are deformities from osteoarthritis, the Bouchard's and Heberdine's nodes, and you see the deformities here. But this person happens to also have, on top of osteoarthritis, gout, and this can happen. And you can see how swollen this is, and you see those white dots, that's the paste. And if it breaks, you see white paste coming out. And these are all the collection of uric acid, the tophi. Again, this is a treatable and preventable condition. So how do we treat gout? So usually we treat gout differently for an acute attack versus a chronic prevention down the line. So if somebody comes in in the middle of a gout attack, we usually use colchicine or anti-inflammatory medicines. And some people have contraindications to one or the other, so we address that. Sometimes we give prednisone, steroids, or a cortisone injection. These can all happen. And there are a few biologic medicines like anakinra, canakinumab that can actually help with gout attacks. They're not FDA approved for that, but can be beneficial. But the ultimate and the best way to treat gout is to treat the underlying cause, right? So high uric acid, let's bring the uric acid down. Yes, diet, hydration, changing the diet, eating healthier, avoiding alcohol, but medications are very effective as well with that. And most people, if they have a high uric acid and they've had a lot of gout attacks, will end up needing a medication. So I'm mentioning some names here just so you know, because some of them may be familiar. So allopurinol is the more common one. Febuxostat is another one. Pegloticase is a newer one that came. It's an infusion. There's particular cases where we use it. But most people will be on allopurinol or maybe febuxostat. Allopurinol has been the one we've had for years, still very effective. Some people are allergic to it, they can't have it, so there's other options. And then there are other medicines for uric acid lowering, which I haven't discussed here. They're not commonly used, but can be used as well. Again, with gout, prevention is the best treatment. So sometimes a person is doing everything right, but they're on medicines like diuretics, water pills, certain transplant medicines that actually cause high uric acid, and then they have kidney failure, so their uric acid is going to be high no matter how much they try. And so medications definitely would help. But if somebody has a high blood pressure and we have different blood pressure medicines, and you have gout, maybe your doctor can choose a medicine that is not a water pill or a diuretic for the blood pressure. This way the gout would be better controlled. Very, very important to avoid alcohol when we have gout or when we have high uric acid. Hydration is important, and avoiding dehydration. Also crucial is to avoid getting more uric acid in your system. So the food you eat, alcohol and food, can raise the uric acid and cause a surge in uric acid and therefore a gout attack. A lot of people know that, like, they had shrimp and they had a gout attack, or they had a sausage or a burger and next day, or hot dog, next day they had a gout attack. So people sometimes can tell what caused their gout attack. So typically we say organ meat, like liver, kidney and all that, or shellfish can cause bad gout attacks or raise the uric acid. But also it's important equally to know that any animal flesh can cause, when digested, a rise in uric acid. and can cause gout attack. So dietary modification has been shown to be effective. I've actually had a few patients where they were unable to take any of the medicines that were recommended for gout due to allergies or liver issues and all that. And they brought down the uric acid, controlled their gout with dietary changes. We're going to talk about more about the plant-based diet in a few moments. So another question comes up, very typical, is if it runs in my family, would I get it? And it depends on the type of arthritis, but pretty much osteoarthritis, rheumatoid, psoriatic arthritis, ankylosing spondylitis, even gout, these can run in the family. Now, the good news about that is if your parent has rheumatoid, it does not mean you're going to get rheumatoid. Yes, there's a risk, but it does not mean you're going to get that. And the best thing that we've learned recently is that your genes don't determine your destiny. So yes, there are fixed genes, color of our eyes, our hair, how tall we're going to be. Okay, those are fixed. There are other genes that are not necessarily fixed, and they don't have to be switched on. We can switch them off with lifestyle changes, healthy lifestyle with healthy diet and stress management and sufficient exercise. And we can keep those bad genes switched off. And that's the good news I want you to know. So another question is, that's really typical. What's better for arthritis, heat or ice? Or even another one is, can weather cause me to have flare-ups? So the weather, I didn't have a slide on it, but just to mention that any changes in barometric pressure can affect the joint that's been affected by arthritis. So it's not wrong if you start having pain and the next thing you know, it's raining or the weather changed or you're in a plane or different altitude. So is heat or ice better? A lot of patients, it depends on a lot of different factors, but a lot of patients like heat. But I'll tell you that if you're in the middle of a gout attack, let's say, or a hot swollen joint or an infected joint, and you put heat, you can make it worse. The swelling can get worse. And that's why a lot of athletes, after workout, they know they're going to get a little bit of inflammation. They ice the joint. So icing would be better whenever you're dealing with inflammation or preventing inflammation. But when it's osteoarthritis and it's achy because the weather changed or it's cold outside, heat can help. Just be careful not to burn your skin with putting a heating pad or anything like that. So sometimes also people like the heat because, you know, when you have rheumatoid arthritis, let's say, and you have a lot of stiffness, you wake up in the morning and it takes really a long time to be able to move. You get in a warm shower, you know you're going to feel better and you're ready to go for the day. And that's fine. Or your hands are very stiff and you run them under warm water. That's also very beneficial. So heat might help in different conditions as well. So what are the foods that make it worse? Well, you know, sometimes, like with gout, we already addressed a few things, but celiac disease, you know, gluten. If somebody has celiac disease, gluten, just even a little bit of gluten or wheat can cause a lot of problems. Now, some people may not have celiac disease, but they're gluten intolerant. Not everyone is, but some people are. And so they consume wheat or gluten and they notice that they get a flare-up. So then they need to avoid that. But not everybody will have that problem when they have arthritis. Gout, typically alcohol and animal flesh, as we said, any animal flesh, not just seafood. I always laugh when I think of seafood. I have a patient who has gout and he tells me he's on a seafood diet. And I'm like, oh my gosh, no, that's the last thing you want to take. Please tell me you're not having a seafood diet. He's like, no. I see and I eat. Seafood diet. I know I can't see you, hear you, Joe, laugh, but I hope this made you laugh a little bit. So anyways, high fructose syrup, and it's almost embedded in a lot of processed foods and salad dressings and processed foods. So be mindful, and drinks. Be mindful that high fructose syrup can be also a trigger for gout attacks. With people who have inflammatory disease, especially rheumatoid, oils rich in omega-6 and saturated fat and trans fat can actually lead to a flare-up. Dairy has been seen to cause flare-ups of inflammation as well, especially in rheumatoid and certain autoimmune disease, psoriasis, even of the skin. And animal protein can also be a trigger for inflammation. Some people may notice that they have triggers to certain foods. So I get a lot of questions about what about nightshades or tomatoes or stuff like that. Not everybody has to avoid those, just like not everybody has to avoid peanuts because not everybody's allergic to peanuts. So if you find that there's a food you can't have because you consume it, even if it's a health food, you consume it, you flare up, I'd say avoid it. And then you can retry down the line months later when your inflammation is settled or better controlled. So there are other things that are they won't affect everyone, but can actually be triggers for some people. And some people may need to do an elimination diet where they come off everything and they introduce one food at a time, maybe just brown rice first, maybe a few zucchinis, and then slowly introduce other things and make note of what has caused them to flare up. So now what are the foods that make it better? Because this is the interesting part. This is where you can have more control, right? So remember, when we're treating inflammation or arthritis or joint pain, we're not just looking for one thing that makes it better. We want to eliminate what makes it worse and add what makes it better. So here's the adding of what makes it better. Anti-inflammatory foods in general. Now, a lot of times people are told this is an anti-inflammatory diet, and it's very confusing out there. What is an anti-inflammatory diet? Is it a Mediterranean diet? Is it this diet? Is it a low-carb diet? Is it the other diet? Well, an anti-inflammatory diet is a diet that when you consume it, it doesn't promote inflammation. And the most effective and the most anti-inflammatory diet that we've seen, whether in studies and clinical practice, in my practice, is a plant-based diet. And it's a whole food plant-based diet, meaning whole, meaning it's not over-processed. Maybe it's processed into a pasta or a rice, and you have to cook it a little bit like a whole grain or bean, but it's not overly processed like in packages and all that. So a whole food plant-based diet, and we'll talk a little bit more about that. Turmeric in food. Turmeric is a spice. We'll show you pictures of that. Ginger, garlic, and spice and herbs definitely make a big difference. We'll have talk a little bit about that later. And plants that are rich in vitamins and antioxidants and phytonutrients and minerals. And by the way, phyto means plant, so phytonutrients are only in plants. So when you eat fruits and vegetables and herbs and spices, you're adding a lot of those elements in your diet, and you're going to be healthier because you're helping your body heal better and your cells get healthier. So to help nourish your cartilage and your joint, these foods can help decrease the inflammation, plus they nourish and they provide the nutrition your body needs. So anti-inflammatory plus nutrition supplies the nutrition. So the foods that are beneficial for arthritis, I just give you a few examples. There's plenty, but let me just go through a few of them. So in general, most plant food, if they're whole, they're not fried or made in a syrup, are actually healthy and beneficial for the joints in general and for health in general. If you're healthy, then your joints are healthier, right? So it's not just the joints that we want to focus on. So spices and herbs, it's amazing. Always amazes me with spices and herbs. So a little bit goes a long way. They're so potent, so powerful. And it ranges anywhere from like your turmeric, your ginger, black pepper. Usually black pepper does very well with turmeric. You want to make sure you have black pepper with your turmeric so it's better bioavailable and has more potent benefit, better anti-inflammatory benefit. Cinnamon, cayenne, which is what capsaicin is made of, cloves, rosemary, sage, green tea, etc. The list is huge. Fruits, berries, cherries, pineapple, citrus, and yes, cherries can help. One of the myths is it a myth that cherries help with gout? Cherries do help with gout. Cherries also help with inflammation in general. But that alone is not going to take care of the problem. Pineapple, we'll talk about bromelain in a minute, but pineapple contains bromelain, and bromelain has anti-inflammatory benefits. Vegetables, especially green leafy vegetables. The more you can increase your diet with green leafies, whether you're putting in a smoothie or you're putting it in your plate or you're steaming them or you're adding them to your soup and stews, anywhere you could add greens, you're doing yourself a favor. So every day ask yourself this question: did I have something green leafy today? If not, go and eat some. Now, when people have kidney stones, oxalate kidney stones, like calcium oxalate, you just don't want to be eating of one kind of green so much of. You want to have a variety of greens. So for example, if you eat too much spinach and only spinach, and you have kidney stones, oxalate kidney stones, you're raising your risk for that. If you eat too much Swiss chard and only that could raise it, or the leaves of the beets, that can increase it, or rhubarb, etc. So make sure that you're hydrating well and you're eating a mixed variety of greens, not just one thing only, especially if you have tendency for kidney stones. Fiber in plants actually has benefits to arthritis. So what is rich in fiber? Every vegetable and fruit, and the richest are the whole grains and the legumes and the beans and the soy. If you're not soy allergic, so you can do soy. Nuts and seeds are also very powerful, especially ground flaxseed, chia seeds, walnuts, hemp seeds. These actually are packed in omega-3, and omega-3 is anti-inflammatory. So you consume those, you get more anti-inflammatory benefit. So what are natural supplements that can help? So the food is the most important thing, and always think, can I get everything from food rather than go for a supplement? Because that's the most natural way it exists and the most effective way. But sometimes turmeric, trying to get turmeric in food in enough amount to give you pain relief sometimes may be too bitter, overpowering for taste, and may not be so pleasant. So sometimes we need to get turmeric or curcumin, the active compound, in a supplement. Now, some people should not be on turmeric, like people who are pregnant, people in the middle of a bile duct obstruction, and people who are on blood thinners. Just be mindful. It's not for everyone. But we've seen very good evidence, and in our practice, we're seeing people feel better on turmeric supplements, whether it's for osteoarthritis, rheumatoid, inflammation. And there's some studies of its benefit in like lupus and other inflammatory conditions. And then they're looking at turmeric as a cancer-fighting benefit, preventing or reversing colon polyps, and so many other brain health, so many other health benefits. So if you just want to do it for natural health, you can add the turmeric spice. Make sure there's black pepper when you add turmeric to have it more bioavailable. Just add it to whatever food you're cooking. If you add it in small amounts, like 1/4 to half a teaspoon, it's not going to be overpowering in your dish. Boswellia has been also featured as helpful for arthritis. Unfortunately, Boswellia, bromelain, we don't have enough studies. We don't have FDA approval for that. So, what's the dose? Is it safe? It's up to the person. I wouldn't go to the shop just seeking Boswellia today just because you have arthritis, but just these are options. They're there. They're out there. So, for example, as far as I'm concerned with bromelain, I'd rather eat the pineapple, put it in my smoothie, or eat it or consume it as a fruit than actually take bromelain, for example. Omega-3 can come from the plant-based foods that we talked about. Most people know omega-3 as fish oil. Well, the fish has to eat the algae in the sea to get omega-3. So we can get the omega-3 directly from the algae source, and that's the active DHA and EPA, or we can get the ALA form of omega-3 from like flaxseed, ground flaxseed. So flaxseed has to be ground for us to be absorbing it. So flax meal, chia seeds, hemp seeds, walnuts, and others. Dark green leafy vegetables have a lot of omega-3. When we eat them in large amounts, we notice that. So people have probably heard of glucosamine chondroitin sulfate or MSM and all that. The studies are back and forth with that. There's no strong evidence that they work. So usually I tell my patients, if they like to try it, they want to give it about 2 months trial. If they feel benefit and they're not having side effects, I'm not opposing to that. But if there's no benefit at all, I wouldn't waste your time being on it. So just to give you an idea of turmeric, for those people who haven't seen it yet, many people may have. So it comes like a ginger root, like it's like a little finger, and it's like this orange color. When you cut it in half, it looks like a carrot, but you can't just crunch it. You have to cook it really. So when they dry it like this, and then they ground it. It has this nice golden color, and it's a very potent anti-inflammatory, especially when mixed with a little bit of black pepper. So you either can use it in culinary cooking, like in your food and all that, or you take it as a supplement. Dark red sweet cherries have been actually studied to have some COX-2 inhibition, which is what celecoxibs like Celebrex have been shown to exert. So more selective NSAID benefit to a smaller degree, not very powerful, but there is some science behind the benefit of cherries. Again, whether you eat it as a dessert, if you have frozen cherries and you take a little bit out, especially when they're pitted, be careful, and then just snack on them, they're like candy. They're amazing. Or put in your smoothie, or have it with your oatmeal in the morning. That's great. And bromelain in pineapple we talked about, especially in the core of the pineapple. But the most effective natural treatment for joint health or inflammation is not going to be one food or one supplement. It's good to know this information, but be mindful that it's not going to be one food or one supplement that's going to fix all. It's a lifestyle. It's a lifestyle approach. And then let's talk a little bit about that lifestyle. So when I say follow a healthy lifestyle, what do I mean by that? So there's enough evidence now that following a healthy lifestyle can actually make a big difference in many, many autoimmune diseases, inflammatory diseases, but also in gout, psoriasis, arthritis, rheumatoid, et cetera, but also with chronic disease, the common ones that we are all worried about because of getting sicker with COVID-19 or others, like heart disease, lung disease, diabetes, overweight, high cholesterol, high blood pressure, and autoimmune diseases, of course, but even other autoimmune diseases that are not rheumatology based, like MS and others as well, multiple sclerosis. So there are a lot of autoimmune diseases that benefit from healthy lifestyle change. So what the advantage of following a healthy lifestyle is not just for seeing the inflammation improve, or maybe having a little bit less pain, or this, or maybe losing some weight. there's many other advantages. So we talked about how the chronic diseases can improve, even chronic kidney disease, heart disease especially. So, there's research done by many different physicians, including at the Cleveland Clinic by Dr. Esselstyn, where they actually put people on a plant-based diet, and they showed reversal of heart disease, opening up of the blocked blood vessels. Well, if it's happening for the heart, it's of course life-saving, because heart disease is the #1 killer in the US. So if it's opening up the hearts and helping people survive better, it's also opening up the tiny blood vessels that nourish the cartilage and the discs and the joints. So that's a bonus from that way as well. But also memory loss and Alzheimer's. So a lot of people are worried about dementia and all that. Well, there's also evidence that following a healthy lifestyle can delay or prevent the progression to that. And of course, obesity and overweight and the complications that comes with that, including sleep apnea and other things. So what is the healthy lifestyle? So I like to break it down into those categories. And then again, I didn't invent any of that, and I didn't make plant-based diet. I didn't create it to make everybody miserable that they can't have all the foods they want. This is the fact. This is the fact. This is what the study and the evidence shows. So when I research all the good studies, this is what I find as a good conclusion, and make it a summary. I could spend another 2 hours just talking about that, but I try to keep it simple here. In fact, I have visits with patients that are only dedicated on healthy lifestyle, where we spend a whole hour talking about that. Diets, the closest and best diets, the best evidence is towards the whole food plant-based diet. So that's kind of your goal. And the closer you get to that, the more benefits you're going to reap from that. We'll talk a little bit more about it in a minute. Exercise, especially with osteoarthritis or joint disease, swimming or pool exercises, biking, Tai Chi, yoga, resistant bands, weight training, range of motion, stretching, walking as well. Tai Chi has been shown in some studies to be as good as physical therapy for knee osteoarthritis. And you could just do that from home nowadays, especially with social distancing. You don't have to go to a gym for that. Just download some videos and follow that. Stress is a big factor. So stress can lead to inflammation. It can lead to cellular aging through telomere shortening. It can cause more problems with mood and spirits. So if your spirits are down and you're not happy and you're sad, that can cause you to have less possibility of healing and cause you to have more inflammation. There's also studies looking at stress and the trigger of flare-ups. Stress can affect your immune system, and then that could cause inflammation. And there's also studies being done on happiness, whether it's in mice they're doing that or translating it to human studies, and they're finding that being happy makes a big difference to your immune system, your immune health, infection fighting, and inflammation, keeping inflammation down. So I say be happy always. Surround yourself with people who love you, love and being loved, and stay as happy as you can. So maybe being grateful, thankful every day, maybe meditate, maybe exercise, what makes you happy. Sleep is important. So we recover, we heal better, we can control disease better when we're rested and sleep better. We have more energy, we're less tired. And supplementation is also necessary. So with the healthy lifestyle, I like to add the word supplementation, because if we're vitamin D deficient, let's say we live in an area we don't have enough sunshine, we might need either to go to a place where we see the sun or take a supplementation. If our B12 is low, that can be deleterious to our health, our nervous system, to fatigue, our blood work. So we would need to supplement. And omega-3s, especially if they're deficient, can affect brain health, eye health, and omega-3 is anti-inflammatory. So there's some benefit in making sure we have enough supplementation. And sometimes we can get these from food or vitamin D. If you live in a sunny country or city, you might not need vitamin D supplements. You can check your levels and make sure they're fine. So when I mention plant-based and whole food plant-based, I just want to mention a few things, because the first thing people think of, well, I don't like salads, or I don't like kale, or I can't have spinach. And then this is all we think about when we think of plants. But I want you to know that there's so much more plant food. So when I get a patient who tells me, I can't eat kale, I don't like it, I tell them, great. You have another 50,000 different plants you can try now. So go for it, go discover something new. Or I don't like this fruit. Have you tried the 100,000 fruits or the other 50,000 varieties that are out there? So I don't think in my lifetime I'll be able to eat every fruit and vegetables and herb and spice and nut or seed that's available in nature. So you can experience every time, try something new, or just stick to the things you love. And you only need 5 good recipes, and you can repeat those. That's really healthy for you. And let's say you are not able to do it 100%. You gotta be easy on yourself. You cannot be hard on yourself, because remember we said we have to love ourselves, love and being loved, and be nice and kind to ourselves. So you don't want to be hard on yourself. So try something that works for you. So maybe instead of 3 meals a day that has meat and dairy and fried food and saturated fat, maybe one of those meals might be a plant-based food. Maybe breakfast could be oatmeal from now on. Oatmeal with frozen or ripe fruits that you have, and maybe instead of putting brown sugar there, maybe you can mash half a banana that's really ripe and mix it there, and now you're like, wow, that's great. Add some pumpkin spice, you got your no guilt pumpkin pie in your breakfast in oatmeal. So plant-based food can be very interesting and really vast variety. So you're not stuck with 1 or 2 things. So it ranges from having green leafy vegetables to all kinds of other vegetables, starchy foods, sweet potatoes, rice, especially if it's brown rice, and whole grain. And yes, basmati rice is fine. And then, the difference is you would cook the grains here in this case. Beans and legumes, yes, you need to cook them. Do not eat them raw. But beans and legumes are very healthy, packed in nutrition, packed in fiber, have been shown to help with longevity as well. Good for your gut bacteria, your microbiome. The benefits of plant-based diet are immense to the gut bacteria and the microbiome. We don't think of the microbiome, your gut bacteria, so much. But if it's unhealthy, you're more prone for autoimmune inflammation and other gut diseases. If your gut is healthy, it can help with autoimmune disease controlling inflammation. And plant-based diet is the best diet for gut health. Now, yes, you can be 80% plant-based and still be very healthy. That's fine if that works for you. We have had, there's been research done through Cleveland Clinic on the effect of eating meat, egg, or dairy, and how when your gut bacteria digest that, they release a molecule called TMA, trimethylamine, and it goes and gets oxidized in your liver and then causes inflammation and damage in the vessels of the heart. So there's a lot of evidence behind the harmful effect of continually consuming more of those inflammatory-based foods. Herbs and spices pack a lot of power. Mushrooms, and it's not a plant, I know, but you can consume mushrooms, especially if you're not allergic to. And mushrooms come in so many different forms. You might not like one variety, you might like another. Mushrooms are great. They have certain benefits with inflammation, but also certain cancer-fighting benefits. And they help the immune system. So they help you better fight colds and infections, as well as ginger and other things as well. Fruits of all kinds, nuts and seeds. When you're consuming nuts and seeds, go when you can with unsalted, raw, better. And plant-based milk, So if you want to have anything that's milk, you can use maybe almond milk, oat milk, flax milk, you decide, soy milk. So enrich your diet with anti-inflammatory foods and make it the basis of your diet. So your plate can look at something like this. This is the Canadian recent food guide, the revised food guide. So you can have your plate look like mostly fruits and vegetables, whole grains in here, which includes quinoa, which is not a grain, but includes that. And your protein can be on this side. I don't like to use the word protein because it's very confusing, but this is how they used it here. So your protein could be your plant-based proteins, whether it's tofu or beans, chickpeas, lentils. And it also, and then these have proteins, by the way, and these have proteins. And if you're going to choose to eat like salmon or some kind of fish or something, just, make sure that you're not, if you have rheumatoid arthritis, that you realize that this might be a risk for inflammation or flares. And if not, then good for you. And then be careful with fish consumption and the risk of mercury, obviously, from contamination. But also even yogurt can be available now as plant-based. So you won't have to get the dairy inflammatory effect from that. So I want to sum it up with a few key takeaways. So whenever you have a chance to prevent a disease, it's so much easier than to try to reverse it. So prevention is key. Start now. It's never too late. So you now heard enough about how to prevent joint damage and how to stay healthy. Go for it. Do what you can. Maybe it's step by step. That's fine. And then watch documentaries, watch speeches, look at studies. Go on certain websites like nutritionfacts.org by Dr. Michael Greger. He's got a lot of good evidence. There's also a great book written by Dr. Dean Ornish called Undo It. Undo It. A great book, has a lot of information, evidence-based information, and a lot of examples of what foods you can eat as well. So avoid triggers that can harm your joints. Like if you know that certain foods are triggers and they're harmful, avoid them. And then especially smoking, I know it's not a food, but please avoid that. And then when treating arthritis, it's important to know what kind of arthritis you have. And sometimes you may need to see a specialist to know what type, and then you can address that, unless it's obvious or you have a diagnosis of what type you have. But most importantly, know that you have the power to make a significant difference towards your joint and overall health and well-being by following a healthy lifestyle. You still have control, you still have the power. I wish you all the best of health and wellness.